Okay, so we have our patient up on the table and we're gonna show you how to administer the subcutaneous fluids. So mostly we go along the shoulder line. There's a lot of extra skin here. We call this tinting the skin when we're doing it. You can go anywhere along here. Realistically, you can go back here, but animals just have a lot of loose skin here, as you can see he does. So this is where we like to go. You can fill it up with fluids. Again, I have my fluid bag. I have 2 clamps going. This one again rolls, so if you can move it, that means the line is open. If you roll it down and you can't move it, that means it's closed. I also have this clamped as well, so no fluids are gonna come out. So we have the needle again, just be careful not to poke yourself. So I'm gonna take it off, and then if you can see here, this is called the bevel, and we call it bevel up. You want the bevel to go in like this, under the skin, and then the fluids are gonna flow out there. So you tent the skin, you create a pocket right here, just like that, a little tent. And then you gotta make sure your clamps are undone. I'm gonna poke it under the skin here. They're gonna jump like that. They honestly jump more when the fluids start flowing than when you poke the needle in. That's normal, because it feels a little funny. And now I'm just gonna unroll this, and then the fluids are gonna start flowing in. And you just kind of want to hold this in there, because if they do move or they flail, it could cause irritation under the skin. So we're just going to kind of hold that in there, and we're going to make sure that those fluids are flowing. Now, if the fluids aren't flowing, you can kind of move the needle around just slight angles and redirect it to know that it's flowing in. You should get a really good flow. Again, you need to have your fluids up very high, because you get a faster flow rate. And just move it around and make sure that they're flowing. And then you'll see once they do start flowing pretty well that this will start to fill up with water with the saline. And then when you're done administering the fluids, you're gonna clamp off this one or the green one up top, clamp it off, take it out, and then just hold your finger on it. It is normal for fluids to leak out a little bit after. That's absolutely normal. And then they're gonna have a little bit of the fluid pocket for a couple hours after until they absorb those fluids.